Welcome back, everyone, to OpenLine. We are talking about holiday depression, something that affects many people, and we want to get at things we can do to get through this time of year. If you are facing depression, you have trauma or difficult issues in your life. We have with us Lisa Eggebeen, Director for Crisis Management and Suicide Prevention at Centerstone, and also the Chief Medical Officer at Centerstone, Dr. Karen Ray. We were talking before the break. I want to broaden it out. We're focused on the holidays, but as far as just suicides in general, how serious depression is in Tennessee, how big a problem is this? And I'll start with you on that.
So within Tennessee, our most recent statistics is that over 1,000 people completed in 1 year within all of Tennessee. You know, if you think about a broader issue, though, in the United States, it's almost around 40,000 individuals each year die by suicide, which obviously makes it a very large concern for not only us at Centerstone, but suicide prevention efforts needed across the nation.
And it's something, it gets talked about a little, but not a lot. And I don't know if people are afraid to reach out for help and talk about it, but when you hear those numbers, it's astounding. 1,000 in Tennessee, that's multiple people every day. 40,000, I mean, that's multiple people every day.
Right.
What do we need to do better? Why are we so depressed? Why is this happening in our society? I mean, do we know?
Well, I think we know that we do have better media helping us understand how many people are completing suicides. And it is really becoming more a topic, and I think the suicide prevention efforts are more intense than they've been previously. So there is work on that. One of the reasons that I think it has caught our attention so much would be the soldiers and the veterans and their issues with suicide. So that's really brought the face of this to our attention.
We also know as mental illness is stigmatized. We know it doesn't stop from race, age, gender, you know, but the unfortunate part is that we don't necessarily always feel comfortable talking about it. So, you know, increasing out there, having more individuals who are willing to acknowledge, but then also talk and educate others about mental illness is important.
And why do you think are we getting past the stigmatization, or are we not making the progress we need to make there?
I think that we're working towards trying to reduce the stigmatization. I think sometimes we continue to perpetuate it, especially in the media, around large-scale events that happen where somebody has endorsed mental illness in their past. But outside of that, we know that mental health prevention efforts and education has been funded more increasingly, you know, in terms of education-wise as of late. So that's a positive thing.
And so this time of year, does it bring out those feelings even more? You know, how if you are inclined toward depression or depressed, how does this time of year and all the media and all the things going on all around us, how does it impact us? What does it do?
I think it's really it depends on the individual. For some people, getting all the family support really pulls the mood up for the moment. For other people, I think the lack of support, things not working, often the lack of financial resources creates more stress at this time of the year. So it really is one person at a time, whether someone might feel more supported or might feel more stressed.
And there has always been the notion that suicides go up this time of year.
Well, I think the fact is actually that there are more suicides in the spring than in the dead of winter. There are also more suicides in the fall. So it's that inflection point, the change of seasons from summer to winter and winter back to summer, where we see more suicides.
So it's not this time of year.
Not generally, but that doesn't mean that there aren't any suicides at this time of the year.
Right.
What do we need to do as a society? What do we need to do to deal with this issue? What do we need to do better?
I would say education is a continuing point that we need to push for, as well as destigmatization. What we want to recognize is that mental illness exists very similarly to physical illnesses, that our head isn't separated necessarily from our bodies, and that it's okay to acknowledge and get help if you recognize that you are struggling.
And why can't we get past it? Why don't we? We're getting better. There's no doubt.
Right.
We are no doubt getting better. That it is a medical condition.
Right.
But still, there's the stigma. Still, there's the concern to talk about it. Why is it so hard for us as a society? I mean.
Well, I think it's hard partly because it's so complicated. If you have a strep throat and you take penicillin, you probably will get well. If you have depression, it might not be the first medication or the first round of psychotherapy. It's very complicated, and as Lisa points out, all the physical illnesses impact the mood, and then the mood impacts the kind of care that one gets for physical illnesses. And we actually know that there are more deaths from heart disease and diabetes in patients with psychiatric illnesses than there are from suicide. So it's a very complicated set of problems, and I think we really have to have a lot of professionals who want to work in this area. It can be a challenging area, but it's also a wonderful area to work in.
I bet you see some truly sad things, but you probably see some remarkable turnarounds, some really gratifying things.
It's a phenomenal thing to see someone get better.
Mm-hmm. And so this time of year, how real is the notion of seasonal depression? As far as the light, the sun is down much earlier, and so that actually leads to a higher level of depression.
Well, we know that near the equator, there's less depression. We know that as you go further north in the U.S., there's more depression. I think it's very real. We also know that light therapy is very helpful. So people use phototherapy lamps 20 minutes a day, and it really improves the mood of many people. One of the other things that works is to go out in the early morning light on the days when there's sun. So being outside on a sunny day in the winter, or we know that people who go to Florida, for instance, often feel better in terms of their mood if they tend to have seasonal exacerbation of their depression.
I would say, just to add to Karen's points, is that during the winter we have less likelihood of being able to get outside. So oftentimes we wake up and it's still dark out, go to work, get out of work, it's still dark out.
That's true.
And so even, the regular exercise, the walks outside, the spending any time out of doors is a little bit less. And we know that exercise is one of those positive coping skills for us to fight those depressive symptoms.
And so is it the light that actually, and that's interesting to me, I'm fascinated by this. I mean, you said the light therapy actually works. And so that's not exercise, that's not, getting out, and I get that. You wake up, it's dark, you come home, it's dark, and you don't get to exercise and that kind of thing. But I'm fascinated that just light therapy can make a difference.
Well, it actually makes a difference in depression that's not just seasonal depression. New studies suggest that light therapy works in other types of depression. So it's really the light striking the retina of your eye. It's pretty fascinating.
Well, that is fascinating. And, all right, so again, things people can do. Let's say there are people out there. Our first caller, Jay, he knows someone who is going through a tough time and is worried about them. So let's take Jay's call and kind of talk about some specific things he can do And I'll start with you, Lisa. What would you recommend there for people? Others know we're going to go through a tough time.
You know, I think that I would, kind of going back to the reaching out to them, making sure that we're acknowledging, you know, that we recognize that this could potentially be a difficult time. I think that what I would ask from them is what's worked for them in the past. Most people have had coping skills that they've been able to utilize when they've gone through maybe an acute, difficult time. This may be a little bit different, but was it his aunt?
Mm-hmm.
Can his aunt potentially find some things that might work for her to get her through this time as well?
And what would you say?
I think it might be useful for Jay to refamiliarize himself with some of the symptoms of depression and think about whether she's really exhibiting those symptoms. And that might be so simple as crying when she hears a Christmas carol, or it might be not wanting to do any of the things that she's usually enjoyed. And then if it rises to a significant level of concern, you know, reviewing this with the person he's concerned about, thinking about whether her primary care doctor might provide useful information, thinking about whether a minister might be helpful, or whether another family member could be helpful in dealing with this. So it's really, I think for me, a matter of trying to figure out the severity, because some milder depressions are more easily dealt with by lifestyle interventions as opposed to treatment.
And when you say cry at a Christmas carol, I think that could happen, I think, to all of us. I mean, we can all get that way. And so that would be maybe a minor,
Right.
That would be a minor level. It's when it gets to they won't get out of bed, right?
Mm-hmm.
They won't interact, or even worse. I mean, when do you get beyond the more minor stuff and really into the areas where, what are some of the things that are just really dangerous?
Well, I think I wouldn't want to wait till they wouldn't get out of bed. For me, that's a little too late. So I think if someone is having a significant problem with crying, they identify themselves as not enjoying anything. If the sleep is disturbed and the appetite and energy are disturbed, those are things that would be red flags. Obviously, if anyone is thinking of preferring to be dead or thinking of hurting themselves, that's really an indication of the need to seek professional help.
Okay. All right, we're going to take a break. And if I want to encourage people to call in, there's the number 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.